Good evening, everyone, and welcome to the Tuesday night, May 26th, 2020 Board of Commissioners meeting. Roll call, please.
Commissioner Willie.
Here.
Commissioner Rogers.
Here.
Commissioner Treese.
Here.
Vice Chair Scouten.
Here.
Chair Harrington.
Here. Great, we have all 5 commission members attending in person this evening. Before we get started on the first agenda item, I want to make sure everyone is aware of some agenda changes since our agenda was first published for this meeting. Item 4B has been revised. That's a Clean Water Services public hearing item. Item 5A is an added item under the action section of our agenda to approve an amendment to the fiscal year 2019-20 pay plan and position and salary report to add classification Chief Equity and Inclusion Officer. Then under the consent agenda, item D as in dog, a link was added to the bid award for approving the bid award and execute contract for the 2020 Road Fund Bridge Deck Maintenance Project. And that's it for changes to tonight's agenda. The first item on our agenda is oral communication. This is an opportunity for members of our community to speak before the board for 2 minutes per individual. Mr. Moss, our board clerk, how many people do we have signed up tonight?
Madam Chair, we have 4 people signed up, but however, I do not see any of them logged into Zoom at the moment.
Ooh. Well, how about if we come back to that then?
We can.
Is that okay with everyone?
Yep.
Okay. So why don't we move on to the consent agenda? Tonight's consent agenda consists of 8 items. 2 items under Clean Water Services, 2 items under Land Use and Transportation, 1 under County Administrative Officer, 1 under Health and Human Services, and 2 under Support Services. What are the wishes of the Commission?
Move for approval.
Second.
We have a motion and a second to adopt tonight's consent agenda. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Any luck there yet, Mr. Moss?
Not yet, Madam Chair.
Okay.
By the way, congratulations, Mr. Moss.
Thank you, Vice Chair Scouten.
You have been designated clerk of the board. Thank you.
Yes, formal action taken. Next, we'll move on to presentations. Tonight, once again, we would like to welcome our staff, and we have 2 members who I assume are attending remotely. Is that right, Kevin?
Madam Chair, we have 1 of them on Zoom. I do not see the other.
Okay. Would you like us to proceed to public hearings first and then come back?
Can you tell me which one is on?
It is Dr. Ann Loeffler.
Okay, we need,
So we'll hold off.
sorry, I'll
It's okay.
find out if she's having trouble.
We'll hang tight. Is it okay, Mr. County Counsel, for us to proceed? All righty. So tonight we have 2 public hearings. The first one is from Support Services to adopt a supplemental budget for fiscal year 2019-2020. This is the fiscal year that we are currently in. And I'd like to recognize Mr. Jack Liang, our Director of Support Services, Interim Director of Support Services. Thank you.
Thank you. Thank you, Chair Harrington. And good evening, Board of Commissioners. I am in front of you to present a supplemental budget for fiscal year 2019-20. As the Chair explained, this is our current fiscal year that is under operations. And there are 3 items included in this supplemental budget. The number 1 thing is to creating a new fund within the county's financial structure. It's fund number 155, called COVID-19 CARES Act Fund. The purpose of this fund is because the county has received the coronavirus relief funding of $104,660,475 in total, and for best practices, we are creating this fund to segregate the revenue that's coming in as well as any expenditures that's going out related with this funding. And that will help us to ensure better internal control within our system as well as ensure compliance with the federal requirements. The second item included in this is appropriating the funding of $104,660,475 in this newly created Fund 155. And we are proposing to fully appropriate this funding just in case the timing of the disbursement of this funding needs to happen in this fiscal year. However, at the same time, we're also proposing a carry forward into next fiscal year 2021 budget that because we're anticipating the portion of this funding is going to carry forward into next year. And then the third item in here is related with COVID-19. This is a $1 million business assistance program that we have already implemented, and this is currently expanded out of the non-departmental org unit, and then we are appropriating the appropriation in the non-departmental and reducing the general fund contingency for this. So those are the three items that is included in the supplemental budget, and I'd be happy to answer any questions.
Commissioners, any questions?
Nope.
Nope. Okay, seeing none, I'd like to open a public hearing. Is there anyone in the room that wishes to testify on this matter? Is there anyone signed up?
There is not, Madam Chair.
Okay, seeing none, I'll close the public hearing. And what are the wishes of the commission?
Madam Chair, having conducted the public hearing, I move that we approve the resolution in order to adopt a supplemental budget for fiscal year 2019-20 as set out in agenda item number 4A.
We have a motion. Do we have a second?
Second.
We have a motion and a second. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 5-0.
Thank you.
While we're on public hearings, while we're waiting for our presenters, we'll go to the next item, which is a public hearing under Clean Water Services to hold a public hearing and adopt resolution and order levying final assessment for the Moss Street Sanitary Sewer Local Improvement District, project number 6984. And welcome. It's good to see you.
Thank you.
Andy.
Yes, appearing in person this time. Chair Harrington, members of the board, my name is Andy Braun, Conveyance Engineering Division Manager for Clean Water Services. Tonight we'll be holding the public hearing to levy final assessments for the Southwest Moss Street Sanitary Sewer Local Improvement District. The project was initiated in response to an April 2018 petition signed by 6 owners in the neighborhood requesting sanitary sewer service. On June 19th, 2018, the board authorized staff to prepare an engineering study and assessment report. In November, after sharing the results of the study with the impacted owners and providing them with an opportunity to testify at a public hearing, the board adopted Resolution and Order 1827, directing staff to proceed with the project. Bids opened in June 2019 indicated the final project would likely result in an assessment that would exceed the preliminary estimate by more than 10%. Owners were given 30 days to withdraw support for the project. Receiving no objections, a construction contract was awarded to Braun Construction and Design on August 6, 2019. Construction was completed in January 2020 at a cost of $243,216, which was 9.5% below the bid amount. Together, construction, survey work, engineering, and administrative costs resulted in a final project cost of $275,718. The project included no off-site or extraordinary costs. 10 benefiting owners will divide the costs evenly, resulting in an assessment of $27,571.80 per lot, which is within 1% of the preliminary assessment. If an owner connects to the sewer by January 6, 2021, 1 year from the date of sewer availability, they will be eligible for an early connection incentive of $2,461.20. This public hearing was opened March 31st and continued to tonight in order to give owners the chance to testify amidst the COVID-19 modified ways of conducting business. One owner requested relief due to economic hardships resulting from the pandemic. At its work session last week, the board agreed with staff's recommendation to lower the project interest rate from 2.56% to the current Oregon bond index rate of 1.39%. The resolution and order levying final assessments has been modified to reflect the lower interest rate. The owner who made the request asked that I extend the gratitude of the neighborhood to the board for its accommodation of economic relief. Staff has received no other comments regarding the final assessments. Following testimony and at the close of the public hearing, the board may adopt, correct, modify, or revise the reimbursement charges. This concludes the staff report for the Local Improvement District public hearing. I'll be happy to answer any questions.
Any questions from staff? Okay, seeing none, we'll reconvene the public hearing that we held over. Is there anyone else who might have testified, Mr. Board Clerk?
There is no one online, Madam Chair.
Okay. Seeing none and seeing none in the room, we'll close the public hearing. What are the wishes of the commission?
Move for the recommended action.
We have a motion. Do we have a second?
Second.
We have a motion and a second to adopt the resolution and order that specify the terms for installment payments and the date for payments or applications for installment payments, and directs that the final notice of assessments be given to each benefited property owner. All those in favor, please vote by saying aye.
Aye.
Any opposed? Commissioner Treese, you are for, right? Yes. Okay, thank you. The motion passes unanimously 5-0. And that takes care of our 2 public hearings tonight. How are we doing? Thumbs up on our presenters. All right. So we'll be going back to a presentation on COVID-19. And I'd like to welcome 2 guests this evening, Dr. Christina Bowman, who is the Washington County Health Officer. We can't see you on the screen yet, but then you also have with you tonight Dr. Ann Loeffler, who I believe is a community physician. Can each of you hear us?
Yes, this is Christina Bowman. Can you hear me?
Yes, we can.
This is Ann Loeffler.
Great. The floor is yours. Take it away.
All right. Thank you so much for inviting us back to give an update on COVID-19. I've invited to present with me Dr. Ann Loeffler. She is a new addition to our Tri-County Health Officer team, and by background is a pediatric infectious disease doctor. We've known her for quite a while as a national expert in tuberculosis for pediatrics, and we are very thrilled to have her join our team. I've asked her to do part of this presentation because she is a clinician and an expert in infectious disease, and she's also a very great educator. So to start, if you could turn to the next slide, we will start with the medical update from Ann Loeffler, and then I will provide an overview of the Key to Oregon study. So Ann, please take it away.
Hello, everybody. Well, thank you for having me. How's the microphone working? Can
It's
you
a
hear
little
me?
bit light. Oh, that's better. Thank you.
Is that better?
Yes, it
And
is.
I just have to warn you, like Christina probably, I am working from home here, and my cat is looking for attention. So please excuse her if you hear her crying.
We welcome coworkers.
That's funny. Next slide, please. This topic obviously could take a great deal more time, so I had to develop a way to organize it a bit to help me think about what a lot of people might want to know about. And Christina mentioned that I love to educate, and I typically insert quite a lot of entertainment into my talks. And I thought for such the short time that we have, I have a limited way of doing that, but I thought we could start with the concept of the top 10 things that people want to know. And this is for some of you who are a little closer to my age, perhaps you remember David Letterman and his top 10 lists. So these are the first 5 things that I will cover. And next slide. First thing I thought you all might be interested in is just how contagious is this new virus. So we call it a novel coronavirus, but its sort of technical name is SARS-CoV-2. It is very similar to the virus that caused the SARS epidemic that we all remember more than 10 years ago. That guy is actually named SARS-CoV-1. So the problem with this virus is that we do not have careful ongoing studies that really tell us how contagious it truly is. And we have been surprised at the level of apparent spreading of the infection from people who have no symptoms. So the fact that we, until recently, have not been able to have the level of testing that we would like, all those things have contributed to difficulty understanding exactly how contagious it is. But we think that roughly 2 to 3 people are infected for each person who is carrying the infection. Now, that is very variable. So there might be people who aren't very good at covering their cough. There might be people with an ongoing kind of smoker's cough, et cetera, et cetera. But on average, we think 2 to 3 people are infected for each person carrying around the virus. Now, that's in stark contrast to something like measles, which almost 100% of the people who have household type contact with a case of measles who are not immune will become infected. So this guy is not enormously contagious. He's just very tricky because he can be spread from people who have no symptoms. Now, you may have been hearing about some of these people they call super spreaders. So there are some examples. For example, a person in a choir where a lot of people seem to have gotten the infection despite the fact that they were standing 6 feet apart, or some of the cruise ships where enormous numbers of people were infected in a surprising way. I read about a wedding in Jordan where one person seems to have infected 76 people. And then we have a situation locally in Multnomah County where there was a rather chatty, not very symptomatic person who was strolling around the hospital wards and seemed to have infected a fair number of people. So we don't understand everything, but unfortunately, it's a little bit more contagious than we would have liked. Next slide. A lot of people ask me, does a mask help? And since I thought this was a family audience, I didn't include an off-color cartoon that I saw kind of using a description if people weren't to wear clothes, how that might correlate. But the short answer is yes, wearing a mask helps. And wearing a mask, even if it's fabric, and even if it doesn't have an elaborate crimping wire at the top, it helps. Masks help both the people who are at risk of transmitting or sharing the infection, and also the people at risk of breathing in the organism. The organism. So people say, well, if a mask helps, why didn't we originally? Why have we evolving? Why are we changing our tune every week? Well, the problem is that initially we really didn't understand the extent to which these people who have no symptoms could share the virus. So that's why the recommendations have been evolving. And we now really are strongly encouraging people to wear masks when they can't keep that 6-foot distance from one another. And I could go on and on about that, and we can talk about it later if some people have more specific questions, but it's very, very interesting science as to how they've discovered some of these things and how we quantify it. Next slide. So you've probably been hearing about the tragedies of people dying with COVID. It's absolutely horrible, and I'm not going to spend time on it now, but there are certainly comorbidities or other conditions that people might have that make it more likely that they'll get deathly ill with this. But in terms of complications, most people who have symptoms seem to have a pretty, run-of-the-mill cold or flu-like illness for about the first week. The things that are a little bit different compared to your typical cold is this description you may have all heard about, where individuals say that on top of what you expect with a stuffy nose, people seem to lose the sense of smell, and that actually is persisting for quite some time for some people, and taste. And then the dry cough that people have and this heaviness in their chest, these things are a little bit unique to this virus. But it's really the second week that things can really go off the rails. So people at a time when you or I might be getting better with the typical cold, some of these people progress on to these severe complications. They literally struggle to breathe. They have an x-ray that has a very, very nasty pattern and is often fatal, called ARDS. They get this process where they get this inflammation throughout their body because their body is overreacting in its response to the infection. And in concert with that, sometimes people clot, and maybe they even get a clot in the blood vessels in their lungs. They can have all these phenomena can lead to a situation where many organs in their body, their hearts, of course, their lung, their kidneys, their bone marrow, their gut, and those are the types of complications that tend to be really causing severe problems and often death. Next slide. So Christina mentioned I'm a pediatric infectious disease doctor, and in fact, at this time, I am still the pediatric infectious disease doctor and hospitalist at Randall Children's Hospital in Portland, and I am transitioning over the next few months to my new role, which I'm very excited about and excited to work with Christina. But I'm a pediatrician. So how is COVID different in children? The good news for us is that it's pretty remarkable. Way fewer children get infected with this virus. Some people think it's because they have more recently had colds with the cousin coronaviruses. There's lots of other coronaviruses besides these two that I've mentioned today. And even fewer of those children get hospitalized. So that's the good news. The bad news is that there is a phenomenon which is very dangerous and even has led to some death in children. My understanding is it was first really described from England, and it's called, now we call it, it's changed its name 3 times in the last 3 weeks. I don't think that's fair. It's called MISC, multi-system inflammatory syndrome in children. And the situation is it's another one of those processes where your body overreacts to the virus and it causes inflammation to attack your own body. It's just not right. So the kids might get red eyes, they get high fever, they get rash, and then one organ after another is in deep trouble. And again, as I mentioned, some of these kids die. The CDC and the NIH and a lot of national subspecialists have been really collaborative and pulled together and developed guidelines for how to diagnose and how to treat this disease. But it's very, very scary. I was working in the hospital this weekend, and I actually had 2 patients who we were worried might have this. And it's a scary, scary day. Next slide. What's the deal about treatment? And some people have been listening to their doctors over the years, and they say there's no treatment for viruses. We use antibiotics for bacteria. And in general, that is true. But over the years that I've been in practice, we have evolved a lot of treatments for viruses. So it started out with herpes simplex virus, and we have good treatment for that now. We have lots and lots of treatment for HIV, for influenza, etc. Not as many treatments for viruses we needed, but it has helped us inform our strategies for COVID. You may all have heard on the lay press about some malaria drugs, which some people were certainly hoping would have some benefit based on some Chinese data. But last week, there was a very large, tens of thousands patients studied using these malaria drugs, and there was very disappointing. And in fact, it looked like there was more death in the groups of patients who received those malaria drugs. So don't do that. Don't be those people who just start to take those malaria drugs. But one drug in particular, it seems to be rising to the cream of the crop, top of the crop there. It's called remdesivir. It was originally developed to try to fight the Ebola virus. And the company that makes it, who I won't mention, so people don't think I have a bias, but the company has donated tens of thousands of doses that have been dispensed through CDC to state health departments. And so if we have cases regionally here in Oregon, the Oregon Health Authority has stock on hand and is developing a process with the local health systems to make it available to patients. Very exciting. Some people are so excited about this that they think that as we develop more data and see how to use it safely, it might become quite the standard treatment, especially for people with lots of risk of bad problems. And finally, the last treatment I want to talk about, and maybe some of you have heard about this as well, once someone has gotten over the virus, their bodies frequently make a response called an antibody. I'm going to talk more about that in 1 second. And if you, after that process is kind of robust, like a month or so later, and you take their blood out, you return the red blood cells, but you save the other part of it called plasma. The plasma contains lots of these antibodies, which could theoretically help fight infection in a different patient. So of course, we have to do all the things we do for blood banking. We have to make sure the patient doesn't have something that they could transmit in their plasma. But we've been doing this kind of treatment for 100 years in medicine. I'm not that old, but I'm told we've been doing it for a long time. And certainly even in my career, there's lots of things for which we do this type of concept. So it's exciting idea, and people are being asked to donate their blood if they have had the infection and cleared it. Next slide. So this is the sort of second group of questions I thought people might like to know, but I thought, should I do a little time check? I've already taken my allotted time.
You're doing great. Keep going.
All right, thank you so much. If I've had COVID, next slide, please. If I've had COVID, can I get it again? I should say COVID-19. COVID-19 is the name of the disease that we get when we have symptoms from the SARS-CoV-2. So if I've had COVID-19, can I get it again? We are not entirely optimistic that this is a one and done type phenomenon. So other coronaviruses that cause 25% of colds, you can get again. Not usually the same winter, but usually in subsequent seasons. The other thing about this family of viruses is they are what are called RNA viruses. That's their genetic material is RNA. Humans use DNA for their genetic material, their chromosomes, and RNA viruses mutate more readily. So there's all sorts of exciting work using the observations of these mutations to track how this infection spread across the planet. But based on those two things that we know, we are fearful that you could be at risk of getting it again. Again, not usually this season. Now, there's other viruses where if you get it again, it's not as severe. And again, we could talk about that. There's a lot of interesting stuff. However, there is some potential it could be worse. So remember, we were talking about ways in which this virus can trigger your body to attack its own tissue, these inflammation phenomena. And there are some diseases where when you get it multiple times, it's actually worse subsequently, kind of like an allergic type reaction. The first time you take a medicine, you don't have a bad reaction, but subsequently it kind of gets worse and worse. So stay tuned. We don't know what this is going to look like. All right, next slide. So what is an antibody, and does it mean I'm safe? So this question goes hand in hand with the last one. An antibody is a molecule that your body makes in response to an infection or sometimes something else, like an allergic phenomenon. So when we do tests where we draw someone's blood and we look for antibodies, we also call those serologic tests. There's a couple of different kinds of antibodies. Well, there's 5 types of antibodies, but your body makes typically 2. And the one that would tell us if maybe we're safe from getting that next protection is called IgG. And there's lots of infections that we really understand what their antibody levels mean. So if I have a certain antibody after I have a certain vaccine, I know exactly what that means. Chickenpox, once I have an antibody, I know I'm not going to get chickenpox again. And the bottom line is we just don't know for SARS-CoV-2 or the COVID-19 disease. We think probably that it means we have at least short-term protection. The problem is there's 2 different parts of the virus that are being used to develop these antibody tests, the spike protein and then a neuraminidase. And so it's really hard to compare apples to apples. but lots of people are working on it. The other big problem with the antibody test is that when you're in an area like Oregon, I know this is consuming us, but the truth of the matter is we have very, very little of the SARS-CoV-2 infection, very few COVID-19 diseases compared to other places like New York, of course. And when that happens, our tests, because none of them is perfect, if we have so few of the infections in our community anyway, a less than perfect test sort of gets exaggerated. And again, if you're interested in more information about that, I'm glad to share it later. Next slide. Vaccines. This is very exciting. And I learned just today, and so I'm always grateful for the opportunity to develop a talk like this. The WHO has a website which is describing all the different candidate vaccines that are being worked on by companies all over the world. And right now, there's 124 vaccine candidates. Merck announced that they're working on 2 more. There's sort of 8 different structures to how the people are working on vaccines. The problem is we literally have no idea whether these early vaccine candidates, that's lingo. So you could go tell your friends at the cocktail party, oh, I understand there's a lot of vaccine candidates. We don't know if they're going to work. We don't know if they're going to confer any kind of long-term protection. We don't know if they're going to have side effects. So in my world of pediatric infectious diseases, there have been epic fails with vaccines, like heartbreaking efforts to make vaccines that cause more harm than good. So we're all holding out hope for a strong, good vaccine. We just don't know when it will be available. Next slide. What the heck is a PCR test anyway? So you've probably heard that most of the tests that we use to look for the virus, usually in the nose, but also in the throat or in the sputum, is called a PCR test. It stands for polymerase chain reaction. And it's this crazy test. Again, I don't have time to describe the whole thing, but trust me when I tell you it's amazing because it can detect even the tiniest amounts of DNA or RNA that is very specific to that one thing. So there are these computers that are size of buildings that have the sequences of every known chromosome and genetic sequence of all human and virus and bacteria and plants and animals on the planet. And the way this test works is it finds a sequence of the nucleotides or the nucleosides that are specific. So those building blocks, if you remember back to your chemistry or biology, if there's one sequence of a dozen of these building blocks, they can build this test to find even the tiniest amount. Now, these tests are amazing, and some of them can take as little as 15 minutes. The ones that are the fanciest take usually about 4 hours to overnight, depending upon it. But the problem is that because it can find the tiniest amounts of the DNA or the RNA, you have to be super careful to not contaminate your lab or your clinical specimen area. So it's really quite tricky and takes careful expertise. Next slide. All right, I think this is the last one, and maybe some of you have heard about herd immunity. So the idea about herd immunity is that we're not cows, no, but if the vast majority of people in your community have had that infection or have had a vaccine, then, and someone comes into your environment with the infection, like measles, you're unlikely to spread it very far because you'll run into an immune person, and you'll have to work pretty hard to find that one person who's not immune. The problem is that the big problem here with SARS-CoV-2 and COVID-19 is that none of us was immune before December, right? December 2019. And so our whole population is now at risk of being exposed and getting severe disease. So herd immunity is very, very important. And how immune does the population have to be to really set up good herd immunity for this guy? Well, one of my favorite epidemiologists at UCSF thinks that maybe 90% of people have to have had it or have immunity based on a vaccine that we're hoping for in order for kind of for our world to be back the way it once was. I've read some other things that are hoping for 40 or 60%, but in Oregon, less than 1% of people have had this infection so far. So herd immunity is really, really important. I think that might be my last slide, and I'm sure I talked too long because it's a problem I have.
Very informative. Thank you.
Thank you.
And now I think we're on the slide Key to Oregon Study. Dr. Bowman.
Yes, thank you. And thank you, Dr. Loeffler, so much for all of that information. I wanted to do an overview of the Key to Oregon study, which is a collaboration between the Oregon Health and Science University and the Oregon Health Authority. So you may have heard this being announced during one of the governor's press conferences at the beginning of May. The Key to Oregon study is hoping to enroll 100,000 people, Oregonians, over the next 12 months. There are invitations going out to randomly selected households, and the participation is all voluntary. There's no cost, and people age 18 and up are eligible to enroll. As a participant, people are asked to daily report their temperatures, their symptoms, and provide other information and surveys. And they are also offered to undergo testing at home. If they develop any symptoms, they will be sent a test kit. And in addition to the symptomatic people being tested, approximately 10,000 people per week will be randomly chosen to take a test. So even if they are not having any symptoms, testing will be offered to them as participants. At this time, they're not looking to do any antibody tests, as Dr. Loeffler described, the serology test. Next slide. So what we are hoping to learn from the Key to Oregon study is whether this can work as an early warning system for Oregon. So they are planning to recruit from a diverse population across Oregon, and with both the random testing and by testing based on symptoms, as people in different communities move through the different phases of reopening, there's a hope that we can have sentinels or warning signs if people are developing the infection and where. So with this study, they're hoping to identify these cases early, with or without symptoms, where infections may be occurring, and how the virus is spreading statewide. As diagnosed cases, they would of course have all of the routine public health investigation or outbreak investigations that would go along with that, in addition to all of the other efforts to control the spread of infection. So this is another tool for public health as we seek to safely reopen, and it gives us a glimpse into what can be going on across Oregon by making testing more available and engaging people in reporting their symptoms, as well as other study information. So I will stop there. I want to check on time and see if there's any questions from the board for either I or Dr. Loeffler.
Commissioners, any questions? No questions here. I would just like to compliment each of you for once again extending my knowledge about this virus and how we're handling it, and helping us through presentations like this that are available to our community members so that we each know more and can move forward in our lives with smarter, better information.
Maybe a trivia question for the good doctors. When was inoculations first done in the United States, and by whom? It was a U.S. president, by the way.
Oh, is that like no, not Jefferson. So I think somebody took something from an animal and tried to inject their child.
Tried George Washington. He was concerned about his troops and that the British were bringing in smallpox and other things, and he was concerned about losing too many of them. And so he forcibly inoculated all of his troops.
That's impressive.
Bit of trivia.
Now we've learned something here too. Thank you very much.
Thank you again for joining us this evening. Was there anything else you wanted to go over with us tonight?
No, I just wanted to bring you this information, introduce you to Dr. Loeffler, and update through her
Great.
on all the new things that we've learned about coronavirus since we last spoke.
Terrific. Thank you to each of you, doctors, and keep up the good work as we move forward in our COVID days ahead together.
Have a good night.
Thank you. You too. All right, that's it for the presentation sections of our meeting. Next up, we have the actions section of our agenda, and we have an item to approve the amendment to the fiscal year 2019-2020 pay plan and position, and the salary report to add a classification for the Chief Equity and Inclusion Officer. And we have two members of our staff here to make a staff report.
Hi, good evening again, Chair Harrington, Board of Commissioners. My name is Jack Liang, Interim Director of Support Services. Presenting with me today is Eva Labonte, the Interim Assistant Director of Support Services. And we are very excited to bring this agenda in front of you today to approve the amendment to the pay plan and the position and salary report to add the classification for the Chief Equity and Inclusion Officer. This is the work that is done in collaboration with the CEO's office. Our interim CEO, Steve Rose, has a lot of work into this classification as well. I will pass it on to Eva to provide us more details.
Good afternoon. So as a result of extensive work with the workplace diversity consultant and with input from our community, we are now requesting that your board amend the fiscal year 2019-20 position and salary report to add the classification of Chief Equity and Inclusion Officer. This position will lead and promote diversity, equity, and inclusion, and community engagement strategies and activities within the Office of Equity, Inclusion, and Community Engagement. The county is in the process of developing 4 additional classifications that were included in the resolution of diversity, equity, and inclusion that your board adopted on February 25th, 2020. These classifications will come before your board in the next fiscal year.
I think that concludes the staff report. Are there any questions of the staff from any commissioners? Seeing none, what are the wishes of the commission?
Second?
We have a motion and a second. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Thank you.
Thank you.
So we had a little bit of trouble earlier in the meeting with our Zoom setup. So we've delayed our earlier oral communications section. So now we're to the second oral communications section. Do we have anyone attending by Zoom?
We do, Madam Chair. We have some people that were getting for the first one, so I start with them, and then we'll move to the 5 minutes.
Perfect.
Okay. All right. Miss Wendy Newsom, I'm going to move you to allow you to talk, so let us know if you can hear us.
Yes, can you hear me?
Yes, we can.
Okay, hello, I'm Wendy Newsom. I am a hairdresser, and regarding touch-based service professionals, I want to know, what is your plan for making testing accessible for touch-based service professionals that are being placed in phase 1 of reopening? Is there room in the budget to offer free testing for those that are being forced to choose between their health and their paycheck that may be returning to work when they don't feel safe or ready? And if cases of COVID-19 increase, is there going to be another shutdown, and how will we access aid at that point? Thank you.
Ms. Newsom, ordinarily, we don't have engagement during oral communication, but we want to make sure during this COVID crisis that people do have availability to accurate information. So I've just called up our Director of Health and Human Services, Marnie Kyle, to address your first question about testing. And if Marnie is ready to take a crack at the second question, I'll have her do that as well.
Okay. Good evening, Ms. Newsom. Marnie Kyle, I'm the Director of Health and Human Services. So your question about testing is a little tricky. Much more testing is available, and most people can access testing through your health care provider. The problem with testing asymptomatic businesses, just sort of in general, is we could test you today and your test could be negative, but maybe you were exposed yesterday or 2 days ago. And so the frequency of testing becomes a problem, and it doesn't guarantee that you don't have early asymptomatic, undetected disease yet. So that's why there's a recommendation that as you open new businesses, especially personal care services, that you wear a face covering, and that you ask your customers to wear face coverings. Certainly you can talk to your healthcare provider and they can help you work through, but I think that you mentioned that you weren't able to find somebody that would do asymptomatic testing. So I'm not sure if that completely answers your question, but that's kind of the best answer we have today. And then the second part.
Your second question was about if there is another, will there be another shutdown? And if there is, how would you get some relief? So I'll take a crack at that one. We're very much hoping that we won't digress, that once we enter phase one, that folks will continue to be diligent about practicing social distancing, wearing face coverings, and that businesses will operate following the state guidelines. But these are state guidelines, and if our number of hospitalizations go up, or if we end up such that our hospitals can't handle any type of surge capacity, there are other prerequisites that we had to meet to get into phase one. So if the Oregon Health Authority determines that our area is no longer satisfying the prerequisites, then it is possible that we would have to go back, that the state would require us to go back to a shutdown, stay home, save lives order. But we don't know that. It's one reason why we're trying to make sure that everyone practices the physical distancing, is meticulous about washing their hands and staying healthy, because none of us want to see us go back to shutdown. We all want to go forward. And after 21 days of being in phase one with fewer restrictions, we're hoping that we'll be able to enter into phase two, where there will be fewer restrictions and more types of gatherings that can happen. So I hope that takes care of your second question as well. So thank you very much for addressing us today, and I hope we were able to help you with further information.
All right.
Who's next?
Madam Chair, Amanda Thornton, are you on the line? Can you hear us? Amanda, can you hear us?
Hello.
Hi.
Hello. Hi. So some of my concerns, I can definitely echo a lot of what Wendy has just said. We're definitely aware of protective coverings and these things that we can do to reduce risk. but there are so many like unknown variables, and it's just impossible to really guarantee safety for ourselves and for our clients. And beyond that, some concerns are, legal protections for us and our businesses. We don't have language currently that protects us from pandemic-related damages, loss of health, loss of life, anything like that. And waivers don't really help. We can hand people questionnaires, and especially in the situation where they're asymptomatic, they are, to the best of their knowledge, reporting correctly. And it creates this scenario where touch base individuals can transmit things very quickly, very easily, day to day, as you noted. And so with these situations, it's just a very risky environment for us all, legally and for our health. And then also looking into the future with what it looks like if we do face another shutdown for ourselves and for our businesses. We definitely need ourselves and our businesses considered and protected in this situation currently and in moving forward. And so these are some of our primary issues. And in terms of what OSHA has outlined in terms of like level of risk, as touch base individuals, there's no language there either that really describes our position. And we, at the very least, are moderate to high risk. A lot of our practitioners, they do facials, they're touching face to face inches away, as a part of their practice. I'm a hairdresser. My practice is different. But we're at a heightened risk than other models of business are. And that really underlines the issue with being in phase one at all, as opposed to later phase inclusion. And so these are kind of some of the primary issues that we're facing and that we're as a community, grappling with. And so, yeah, what can you tell me about that?
I mean, from the public health disease prevention perspective, I think you're right. We have imperfect strategies, but there's nothing that says you have to reopen. And I think that both business owners and customers are going to have to really evaluate their comfort level in these risks. And that, I know that's the answer from the disease perspective, disease transmission, public health perspective. I don't have an answer on your question about legal protection.
I'm not a lawyer either, but Rogers.
That's Commissioner Roy Rogers' voice.
Yeah. Hello, how are you doing?
Hi there.
Hi. I'm not a lawyer either, but every business is faced with this. It's a terrible situation. What happens is every one of and I'm a small business person too, and every one of our policies now has a rider on it or some kind of a disclosure that says that our insurance companies won't cover us. There isn't any sort of effective immunity that should have been put in state and federal law when they started doing this to say that we're exempt so that we wouldn't get all these suits. I have a lot of sympathy for you, but everybody's facing the same thing. It's a terrible situation, but at this level, we don't make federal or state law, and we certainly are not insurance companies. So write your local congressional folks and your local folks who are in your industry and say they need to clean it up, because I'm right there with you. I understand it's a terrible situation.
And definitely. And we've been in pretty constant communication with every level of representative that we have access to, basically looking for understanding and some level of advocacy with our higher level representatives. And this is just the best that we can do to push for protection of our health within our industry going forward, within our various industries represented within touch-based services, which do face very unique challenges as opposed to other business models.
Thank you, Ms. Thornton, for sharing your thoughts with us.
Thank you.
Mr. Moss, do we have anyone else?
While we're on the topic, if I may, Madam Chair, we had some questions submitted by Bree Pine, and while Marnie is here, she's aware of these, so she can just answer these real quickly. Ms. Pine wanted to know what the county can do to help provide recommended PPE for businesses opening up in Phase 1, and if
Let's take them individually.
yeah, you got it.
So for recommended PPE, we do have a link on our COVID reopening page of the Washington County COVID page. And it's a link to Business Oregon, which is a list of vetted PPE providers. So that is on the website.
And then the second question?
Does the county have any plans on helping small businesses get access to testing?
So we do have plans for to provide what we kind of refer to as hotspot testing. So if a business is impacted by cases, then we do an assessment to determine if it would be helpful for others within that business area to have testing. I'm not sure if that exactly answers it, but yes, we do have plans to help all residents, businesses, and organizations access testing when it's indicated.
So essentially, there's presence of the virus.
Yes, yes, and everyone should start. I mean, if you're symptomatic, the first thing you should do is to call your healthcare provider and talk to them about whether testing is indicated. But if a business has been impacted, so in other words, if a coworker or a client tested positive and public health determines that more testing would be helpful to the business, then we do have plans to help them access testing.
Then the third question, Mr. Rapplier, if this is a legal question, it says, can the city pass some sort of legal protection in terms of liability for small businesses? So you could
Madam Chair, that obviously we're the county, but no, that wouldn't be upheld in the state courts. It's just, it would need to be legislative action of the state legislature.
Okay, so I think those were the three questions from that person.
Yes. Thank you, Madam Chair. Our next speaker is Jim Long. Jim, I'm going to allow you to talk. Can you hear us?
Jim, can you hear us?
Can you hear me now?
Yes, we can. Please go ahead.
Maybe I need to turn down the mics. Okay. Nice to be here with you. I'll turn down my sound. In the early 1970s, I've got to turn down one of these.
Go ahead.
Can you hear me? You can't.
I can hear you. Now we can't hear you.
He's muted on his end. Let's see if we can.
Can you hear me now?
Yes, sir.
Okay, in the early 70s, I heard numerous times on the TV and radio, Governor Tom McCall saying we need to protect this thing called Oregon.
Mr. Long,
CPO4M
if I may, you are on the Zoom and on your phone, so if you want to mute one of those, that may take away the feedback for you.
Okay, I'll try this one. Can you hear me now?
Yes.
Okay. Back in the early 70s, I heard numerous times on TV and radio, Governor Tom McCall saying we need to protect this thing called Oregon. CPO4M has been especially involved over the past 5 years in protecting significant natural resource areas. CPO4M is not against development, but we believe that both county and cities should follow their own community development codes. Here in this era of global warming, it's very important to do that. I don't know how many of you saw last Friday afternoon the first virtual Land Conservation and Development Commission meeting. You probably heard the Oregon Land Conservation Development Commission voted unanimously to issue an enforcement order for Washington County due to its lack of compliance with statewide land use planning goals designed to protect significant natural resources. The commission also issued an injunction against Washington County from processing development applications for properties containing areas designated as, quote, wildlife habitat, unquote, on county zoning maps until it comes into compliance with the applicable land use planning goals. Under the commission's order, the county has until May 1st, 2021 to come into compliance. In the meantime, Ms. Jo Warren and many other CPO members who have been actively involved in legal challenges to the development of SNRs in Washington County over the past several years hope to work with the county in crafting new ordinances to ensure that these sensitive areas are given meaningful protections to ensure their continued existence for generations to come. Quote, clear and objective, unquote, standards will save time and money for developers, county planners, elected officials, CPO members, and the general public. On a slightly different issue, back in September of 2015, the CPO 4M, 39 people there unanimously passed requesting that the county adopt some preservation for trees. And there's many quotes I can use here from the Metzger Progress Community Plan that talk about tree preservation and language that discusses the maximum retention of trees. Because of the importance of trees and other natural vegetation to the wildlife habitat and scenery of the community, development shall be designed to minimize the area disturbed. Development approval shall not permit removal of more than 50% of mature standing trees 6 inch in diameter or greater, unless demonstrated that removal is necessary to permit development at the site of planned density. Development design and clearing for structures shall provide for maximum retention of larger trees. That's all I have for you today. Are there any questions?
No, as you know, during oral communication, we don't usually take questions. So I just wanted to give you the benefit of some information from our work session today. We asked our staff and county council with regard to next steps given this enforcement order, and our staff is taking a look at the effects of this on current applications as well as in the months ahead. As you know, we are moving forward with ordinances in our ordinance season to address these clear and objective standards. And in about a week or so of time, our staff will be updating information for property owners so that they're informed as to how this enforcement order may be affecting them. So just a brief update on that. Mr. Moss, anyone else?
Yes, Madam Chair, we have Dale Feek. Dale, can you hear us?
Mr. Feek, can you hear us?
I think I just unmuted myself. Can you hear me? Yes, I can hear you.
Yes, go ahead, please.
Thank you, Madam Chair Harrington. Commissioner Jerry Willie, District 4, my commissioner, and esteemed commissioners Dick Scouten, Roy Rogers, and Pam Treese. I'm going to try to speak a little slower. When I listen to myself on TV, community TV, I didn't come through very clearly the last couple of times I've spoken. I have three topics. The coronavirus positive cases in District 4, that's Commissioner Jerry Willie's district. Represented Mitch Greenlick legacy and how he was mentored by a Republican. And the third email I sent to you the second email I sent to you in writing today, the New York contest, wear a mask. So number one, I got on the web page of the county and found out who was my commissioner, and I actually found out the location of the boundary lines for each commissioner. And I was surprised, I shouldn't have been, of how big District 4 is and how you, Commissioner Willie, have a large territory. I also got on the state's link by zip code of the positive cases of the the virus in the county. You know, that's updated every Tuesday. I didn't get the update today, but it became very apparent that your District 4, Jerry Willie, with zip codes of Forest Grove 97116 and Cornelius 97113, that has the highest number of positive cases of the virus in Washington County. So I said, please work with the mayors, councilors, and administrators to reduce the number of cases and deaths in Washington County. And I sent this email also to the mayor and city councilors in Forest Grove. And 2 of those councilors replied back to me, and I'll mention that later. Then I got on another site by the state, and that was, again, if you get on the interactive map by the state and you have the link by that, you can find out specifically where the cases are, especially in nursing homes. So please take a look at that. And I assume Marnie is using that data. Number 2 was Mitch Greenlick. He passed away, and he had a legacy that was impeccable. I wrote a letter to the editor and the Washington County Times and to the Oregonian, and I attached that for you, commissioners. And I said, one of the best ways to honor, remember, learn from Representative Mitch Greenlick is to read his book titled Capital Letters. Representative Greenlick takes us inside the Capitol to give us a front row seat at the process of lawmaking. And I gave you some quotes, and I'm just going to say one of them. 2 of the quotes. He said he was mentored by a Republican legislator. You can accomplish a lot if you don't care who gets the credit. Truth is, sometimes we can get things done. Sometimes we have to compromise to get part of what we want accomplished, and sometimes we fail altogether. It's a little bit like life. And that's the reason I like conservative and liberal people on the county commission. And he also said, rights come from wrongs. And he gave my personal story, he says. I'm willing to wager that each of you has heard a personal story depicting the wrongs that come from people not having access to effective and affordable health care. 3 years ago, that was in 2013, I went to a routine dental examination. And I'm saying, read page 269 to learn how that examination saved his life and changed Representative Greenlick's point of view. And I also sent that to the directors of the legislative directors of Washington County, because it's a very good read, and I hope that they all read capital letters. And as a way, Commissioner Jerry Willie, to support your fellow elected officials, that's Forest Grove Councilor Christy Cotti and Val Valfrey. They emailed me and thanked me for the email to you as my District 4 Commissioner. And I'm saying, please get on New York Governor Andrew Cuomo's and daughter Cuomo's Wear a Mask contest ban. Governor Cuomo decided to air the top 2 highest vote getting submissions. The ads will be broadcast in New York. I hope that the ads will be aired all over the United States, in particular Washington County, based upon the expert public presentation that was given by the health people in Washington County. And I gave you those links. So sincerely, with respect for your dedication as elected and hired government workers during this pandemic, you're competent, you're dedicated elected government officials and hired staff. Thank you very much.
Thank you, Mr. Feek. Mr. Moss, do we have anyone else signed up tonight?
We have 2 more people, Madam Chair. Olivia Hawthorne, can you hear us?
Olivia, can you hear us? Olivia Hawthorne?
Hello, can you hear me?
Yes, we can. The
Hi.
floor is yours.
Thank you for squeezing me in. I would like to expand on a little bit what Wendy and Amanda had to say. We are actually part of a group called the Oregon Hands-On Collective, made up of hairstylists, barbers, estheticians, nail techs, and other touch-based service providers with huge concerns related to being part of the phase 1 reopening. I'm going to try to squeeze in a lot here, but there's 2 sort of overarching points that I think we really need to touch on. And the first one is the occupational hazards that we will be dealing with and what we're being given, the tools that we're being given or not being given to do this effectively. The guidance that we're being given suggests that, well, it doesn't suggest, it requires a screening process that relies on the assumption that people are going to be truthful and that they have symptoms. So we're supposed to be asking people questions when they come in or prior to their appointment to screen them for COVID-19, which is not going to be reliable if a large percentage of people are asymptomatic. We work in extremely close contact with our clients. I'm a bridal makeup artist. I work within 10 inches of my clients' faces. They cannot wear masks while they're receiving these services. So while the general public is being told to distance by 6 feet, we are not being given the opportunity to do so. So the other side of this issue is the financial impact to all of this. We get told a lot that we have the choice to stay closed or not to operate if we decide that we're not ready or we can't get a hold of the PPE or for whatever reason. It's not really a choice for us because once we enter phase 1, we are no longer, or most of us will not be eligible for PUA anymore. So it really is not a choice. It's feeling like we're being sort of shoved into the front lines with a choice to either go back and make the best of it or to lose our incomes if we don't feel that we're ready. Some other challenges related to the financial piece, the cost of the PPE that we're being asked to take on, huge investment for people who have not worked in 2 to 3 months to make. The availability of PPE is really tough. A lot of us can't find barbicide, which is a basic disinfectant that we have to have in normal times. The other issue is that for salons specifically, reduced client capacity, where a hairstylist may have been able to take 6 to 8 clients in a day, they're now going to have to cut that capacity in half, depending on the size of the salon. If they can't distance people, they may have to spread out chairs or schedule shifts differently. So when you pair the cost of all of the PPE that we're required to have with the reduced client capacity, it's going to cause a lot of people to no longer be profitable and eventually probably have to close their businesses. Going back to the occupational hazard part, we are in close contact, but the other piece of that is that we have prolonged exposure, which we keep hearing is really key to transmission, to prolonged exposure. So if I'm working 10 inches from my client's face, she can't wear a mask, and I'm with that client for an hour to an hour and a half, obviously the risk is much higher. So we're coming to you at the county level because we've all written letters to the governor. We've been loud. We've made television appearances. I gave an interview to The Atlantic about a week ago. We are trying everything in our power to get heard because we don't feel that we have the protections that we need. It's not really a choice for us. So I guess I know you're not answering questions, but I guess I wonder if at the county level, is there anything can the county have the autonomy to make their own decisions when it comes to moving us out of phase 1 or making any kind of modifications to the phase 1 reopening to help us with this? So thank you. I tried to cram in a lot there.
Thank you for sharing your concerns with us, Ms. Hawthorne. Please know that we are empathetic to your concerns, but you're right that all the guidance for your sector in the industry, personal care, is defined at the state level. I'm looking over at our legal counsel because you were asking the question of, does the county have any opportunity for having any control over what happens during phase 1? So I'll turn that over to Mr. Alan Rapplier.
Madam Chair, members of the board, thank you. Yes, it's a very difficult situation, and the state is the one who's been giving guidance on that. Our EOC has been helping getting information out. As you know, we have ability to help small businesses, and we have some funds available for that. But other than that, it's just a difficult situation.
We're sorry this is very hard for you. It's a challenge throughout our community, and we're doing our best to try and ensure that people are very careful as they move forward in the days ahead. And we're trying. So my best wishes to you.
Right, Madam Chair, we have one last person, Lisa Braun. Lisa, can you hear us?
Lisa Braun, can you hear us?
Hi, yes, can you hear me?
Yes, ma'am. Please take it away. The floor is yours.
Well, first of all, thank you so much for giving us all the opportunity to speak tonight. I am also a part of the Oregon Hands-On Collective, and I would just like to reiterate some of the points of my colleagues. And I would also like to highlight the fact that a lot of us are not familiar with local politics. We are not avid, active, or frequent participants. And so navigating the political system and trying to make ourselves heard during this time when our voices are so critical and being so ignored has been deeply frustrating. Tonight, I think what a lot of us are seeking from you is a little bit of advocacy, understanding that you are not in a position to make radical changes. You're not in a position to give us the things that we want, but you have more access than we do. You have louder voices, you know more people, you have more connections, and we're able to reach you on this platform. So on behalf of myself, I'm a makeup artist. So my work is exclusively with people's faces, their mucous membranes, their noses, and their mouths. And my clients can't wear masks when I work on them. So being told that this is simply a difficult situation and that you're sorry it's a little difficult to hear that, because while that's true, it is a difficult situation, and I can accept that you are sorry that we're finding ourselves in it. The risk and the danger that people like myself and Olivia are in, and Amanda and Wendy and our other colleagues and peers, is a little bit different than other people who don't have to physically touch the bodies of their clients in order to do their jobs. I don't know where Governor Brown got the idea that putting us in phase 1 was somehow supportive of a plan that would include reduction of loss of life, but we're high risk businesses. And my understanding is that the whole point of a phase plan is to reincorporate low risk businesses first. It makes absolutely no sense to have us be part of phase 1, and we need voices like yours who can reach a little bit higher and get up into the upper echelon of Oregon's politics than we can. We've tried calling, emailing, like Olivia said. I've made 2 television appearances. I've spoke with countless journalists. I've emailed every single person that I can think of, including asking for an audit. I don't even know what that means, but I am contacting every single person that I can think of, because there is nothing in the phase 1 plan that indicates that people who own businesses like mine were consulted in the construction of that plan. Every time we've pushed back on it, the only thing that we've heard is that a panel of doctors and scientists were consulted without being given their titles. What did they study? What do they know about touch-based services? Have they ever had their makeup done? Do they know what it's like to be a hairstylist shampooing someone's hair, breathing into their face? Moreover, do they know what it's like to have your client lie to you and tell you that they don't have the flu or that they don't have herpes simplex virus, when in fact, in the middle of your service, you discover that they do? All of these decisions and all of these plans are contingent on the fact that people are going to be responsible and that they're going to be honest, but all too often desire trumps our best judgment, and people make decisions based on what they want rather than what they know to be responsible and what they know to be right. We're being put in the position where our lives and our livelihoods are being used as a human shield against this crisis, this financial crisis that the state is in. And I would hope that after listening to us tonight, if not as a political body, but as members of the community, you will consider the danger that people like myself are being put in. Being put into phase one does not leave me with a choice about whether to go back to work or not. I have not been paid since March. I have not received unemployment yet. I haven't received PUA. I can't afford to keep going. I don't have a choice, but it is not safe. So, if not as a political body, I hope that as individual members and people, my fellow Oregonians, my fellow Portland residents, you'll consider that there are people who just don't have an option, and we need your voices.
Thank you, Lisa. I just want to make one thing clear from my understanding of all the work that the governor and her team put forward in first the draft sector guidelines and then the final sector guidelines and the framework for Oregon's reopening strategy, which articulates the guidance or the requirements that define phase one, phase two, and phase three. At no time did I hear the phrase low risk for any of those sectors. As part of what defines phase one or distinguishes phase one from phase two is the size of gatherings. And so what we clearly know is that until we get through phase two, we're not going to see gatherings of 250 people or larger. We're just trying to get to the phase, well, in phase one, we can have gatherings of up to 25 people, which is different than what we've been able to do for some businesses under our current aggressive response. And then from phase one into phase two, then the number of people will increase from there. But in both phases, phase one and phase two, so far, the sector guidance is the same. But I'm sure we'll learn more during phase one, and that the governor will probably come up with a new set of possibly sector guidance for phase two. But that's the best we can do at the county level. We have to point folks to the state information on the website, coronavirus.oregon.gov.
I would just add one comment. I think it would be a mistake not to understand very clearly that we've been exercising our voices loud and clear. We're very concerned about the economy. We're very concerned about local business. We want to open them up. It's not ours to do. And as I tell folks in my particular district that I represent, that we weren't elected to go to jail. We'll make our statements. We'll certainly be an advocate. But we can't violate state law. And it's frustrating to you. It's frustrating to us. Frustrating to the people who might be watching tonight. It's just a bad situation. We're doing everything we can to quickly resolve it. We get 3 and 4 briefings every day out here. You would probably get tired just listening to them, as sometimes we are. But please don't make the mistake that we don't listen and don't care and don't advocate, because we are. It's not within our wheelhouse. We don't have at the local level the power and authority to do anything at this point.
I guess it's not entirely clear to me. I think in this case, are we hearing from speakers that are concerned about not opening rather than that they insist on opening? I think what I'm hearing is that they're in a field and profession where they're very concerned about opening rather than the other way around. And if phase one allows opening in this area, I take it that your concern is that there are benefits that you might otherwise be able to get that you can't get, such as unemployment or that type of thing, that you can't get if you actually are at least legally allowed to open. If my understanding is correct, I've certainly sympathized, but perhaps we should be working with you to raise your concerns with those who are making the rules and regulations, including the governor herself.
It's my understanding that the only types of businesses that are not authorized to open up during phase one are those that deal with larger gatherings, like bowling alleys, large entertainment venues. So beyond that, all, a very short list of businesses, all businesses under phase one can open.
That's as long as they're going to be social distancing in.
Yeah, under
But,
certain conditions,
But
that's
how do you,
right.
the kind of work they're doing, maybe by definition, can't be socially distantly safe. So if the concern is that you're being precluded from benefits because you're required to be open, I'm not sure that's true, but I think we probably need to have more follow-up information and hear more from you and work with you to put a fine point on the points that you raise.
All right, Mr. Moss, do we have anyone else signed up?
We do not. That concludes it.
Okay, so that's it for oral communication this evening. Next, we'll move on to board announcements. I've got a couple of things per standard procedure. I'm announcing that our next set of meetings are tomorrow night. We're having the public hearings for our 3 different budget committees. The North Bethany Community Service District for Roads, that public hearing will start at 5:30 p.m. Then second at 6:30 p.m. will be the combined Enhanced Sheriff Patrol District and the Urban Road Maintenance District Budget Committee public hearing. And then at 7:30 p.m., the county budget public hearing, which also includes the Service District for Lighting number 1. The following week, Tuesday, June 2nd, we'll start our work session at 8:30 in the morning and have a pause from that for our board meeting at 10 a.m. Then on Thursday of next week, we are slated to have a roundtable at 9:30 in the morning. And then the following Tuesday, June 9th, we will just have a extended work session starting at 8:30 and no business meeting that day. Beyond that, I just wanted to share another comment that I neglected to share earlier when we were adopting the consent agenda, but I wanted to thank Clean Water Services for the item on the consent agenda for awarding the master contracts for vegetation management services. I really appreciated seeing the number of categories in the table, including experience working with prevailing wage projects, but particularly the COVID certification, that 9 of the 25 firms on the master contracts list for vegetation management services, 9 of the 25 are COVID certified. Thank you very much. Are there any items from the commission this evening?
Move we adjourn.
We have a motion to adjourn. Is there a second?
Second.
With a motion and a second, all those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously, 5-0. We are hereby adjourned. Good evening.